Welcome to Herbally Yours, an adventure into the world of natural medicine. Here is your host, Dr. Ellen Kamai, the natural nurse who will help you take the leap to ultimate wellness.
Greetings, and thank you for joining me, Ellen Kamai, the natural nurse, for another edition of Herbally Yours, right here on the voice of Nassau Community College, 90.3 WHPC. Listen on air or online at iHeartRadio, Odyssey, TuneIn app, smart speakers, or our own award-winning nccradio.org and the WHPC app. So I'd like to tell you that Herbally Yours brings you the latest information about the many facets in the world of natural living. And today, my guest is Dr. Jess, and she is an osteopathic physician who recognized her path to become a doctor early in life. She's an avid athlete and health enthusiast, and she has a very focused specialty with energetic healing, and we'll let her tell you how she came to that. Now, you can always find Dr. Jess, since she is also doing consults virtually, at jessicabelldoe@gmail.com or Dr. Jess, Jess, bell.com. And of course, we'll have live links on our archive so that you can find her. So thank you so much for being our guest today, Dr. Jess.
Yeah, Ellen, thank you for this opportunity. I always love to connect in all of these ways so that people can find us.
So let's go back in time. And what led you to become a physician, number one, and an osteopath, number two?
Yeah, great question. I know we have a short time together. So I don't recall making the decision to become a doctor. It feels like something that I just kind of knew. And I started really talking about that out loud when I was 4. That was a year that for me was really pivotal. I lost my dad to a sudden cardiac death. I was run over by a very large passenger automobile. And all at age 4 knew that I was here to pursue a career in the healing arts. And at that time, it meant becoming a doctor. So that injury that I sustained after being run over was really the stimulus for me pursuing a career as an osteopathic physician versus an allopathic physician. So an osteopathic physician is parallels an allopathic physician. The credentials differ. So a DO is a doctor of osteopathy, and MD is a medical doctor. And when I went toward becoming a physician, I had already recognized that some of the modern medical approaches were limited because I hadn't really received the help that I needed in the MD world, and started to pursue alternative healing modalities to help my own body as a result of the injuries that I had when I was a kid. And so the osteopathic model was something that actually came to me later on, even though I had been really interested in medicine from such a young age. I grew up in the Boston area, and, an MD was really all that I'd ever heard of, as being like the only path to become a doctor. And I just remember hearing about osteopathic medicine and lit up my whole body. I mean, literally the day that I heard those words, osteopathic doctor, for the first time, I had a transmission. My body just started to get chills and tingles. And I was like, what is that? And at that point, I was in my mid-20s, and I was really, on my way. I'd graduated from college, pre-med. And I had been really disheartened by the medical community because after college, I started working in the Beth Israel Deaconess medical system, and started talking to a lot of MDs and asked them all, would you do this again? Do you enjoy your life? I started kind of interviewing doctors to make sure that I was really on the right path here. And pretty much everyone I talked to at that point who happened to be an MD said, don't do this, don't become a doctor. But it was really hard because I just felt so called to pursue that path. I didn't know why. It wasn't rational. It was just a drive that I had internally. And so as far as, this insight that I had around osteopathic medicine, I learned that osteopathic medicine is a modality that accesses a hands-on healing approach to turn on our own innate self-healing capacities inside of our bodies. And that was it for me. And that's really, I applied right after doing some research about what osteopathy is, only to 3 osteopathic schools, and chose the one in the northern part of California called Toro University. And that's where I graduated from. So it was an easy sell once I just had to find out what is osteopathy.
I thought you were going to say on Long Island is one of the
schools, that's
right near my house.
Oh, great. Yeah. They're, so the Osteopathic Medical School, I believe has their hub is in Long Island, although they have an MD school, medical school, I think on Long Island, and then their osteopathic medical school. Now there's a few of them, but the one that I went to is in California.
Well, I would say that you made an excellent choice. Very often, a big thing that I do is career counseling for people who do want to pursue some kind of career in natural health. And osteopathic medicine is high on the list because you get all the training of a medical doctor.
Yeah.
Your license is good in all 50 states. Unlike naturopathic physicians, I would say naturopathic training is excellent, and it's even more focused on all natural. But the challenge is that licensure is not everywhere, which you are licensed as a physician.
Correct.
So, but yet in osteopathic, they do teach a little bit more of natural and also actually touching people, which seems fun and conventional.
Yeah, I know. Although even that, in today's day and age, is becoming the way in which the osteopathic medical schools are teaching the true osteopathic hands-on healing arts has changed so much. And there's a lot I could say about that. I used to work as I was on faculty at the University of New England here in Maine, where I live. And it was really, again, a bit disheartening to see how much, osteopathy from its original foundation in the late 1800s has shifted, has changed to become much more mechanical and a lot less spiritual, which is what it really started as.
And a lot more drug-based, because you also have the ability to write prescriptions for all pharmaceuticals. And I find that medicine in general, and I've been a nurse since 1973, even then, but much more so now, it seems like the entire focus is to see how many pharmaceuticals can we get each person to be using, rather than how do we heal everyone.
Yeah. So I was just referring to the hands-on osteopathic. So yes, I agree with you completely that, I think that a lot of DOs have become really, MD-like more and more so over the years, using prescription medications, interventions, injections, and surgeries in place of putting hands on people, and really,
which can be useful at times. We don't want to throw those things out. It's
important.
Prioritization.
Yeah, absolutely.
So you went even further because you have a specialty that you call energetic osteopathy.
Yeah, I do. Well, I just want to share that what happened for me was a real journey because, and you really it was a great segue with what you just shared. So in medical school, I learned how to do hands-on osteopathy, but in a mechanical way, meaning I could crack your back and your neck. I learned all kinds of things to put my hands on people, but it was far from what I learned later after medical school. I learned a form of osteopathic treatment called biodynamics from a man named Jim Jess, among others. So it's a more cranial-based methodology, very spiritual and very, very, very subtle, but powerful. So in medical school, I didn't learn that. And as a result of that, I wasn't really all that excited about, going into a specialty that was really just a hands-on specialty, which is what I did later on. I chose something called physiatry, actually. So I became a physical medicine rehabilitation specialist through residency. And what did I learn how to do? Injections and medications and referrals for surgeries and things like this. Physiatry is like an orthopedic and neurologic specialty minus the surgery. So that's where I started. I saw the shortcomings of modern medicine inside. I was an inside, every day going to work in a pain management clinic, and it was horrific. It was the most challenging 6 months that I've had in my entire clinical career. And I left that job very quickly because I just felt like I was contributing to the suffering of my patients who were not.
Wow, wait. Dr. Bell, that's a very incredible statement, because you went into becoming a physician to do healing, and yet you felt like so many physicians, which is why there's such a low satisfaction rate among physicians, that you were actually contributing to worsening of the patient condition instead of the opposite.
Oh, 100%. I mean, I was contemplating every other outlet to get out of medicine at that point. That was back in 2009. It was my first job out of residency. And so I left very quickly, actually. And I wasn't sure what I was going to do. I went into a pretty long period of contemplation, of life contemplation, because I wasn't, I was so driven and so passionate to help other people. And I knew this was the exact opposite of help. This was enabling. This was codependency. This was really, I felt like I was a glorified drug dealer. And so I basically did some incredible soul searching for a while. And what I heard, I've always been very guided, very spiritually connected. I lost that connection for a little while in the middle of my life, but it really came back around this time. And I was guided to go back into training and become an osteopathic physician, with a board certification in what's called neuromusculoskeletal medicine. And then I opened up my own practice in 2012. So during that time, transitioned. So I was no longer prescribing medications. And I was really, talk about natural healing. I did prolotherapy, which is a form of regenerative medicine. So I was helping people's joints and tendons and ligaments repair, and doing, hands-on osteopathy. So I combined those two things together in this practice and did that for about 10 years and loved it so much. But in 2020, I closed my practice. I was really tired. I felt like I had become so much more connected to my own healing I early on started doing a lot of meditation retreats. I found Joe Dispenza's work, which is very energetically based. I found, I was really connecting in with Greg Braden and Bruce Lipton and others that were talking about the body being made of pure energy. And I had gotten more subtle in my touch, but I was starting to feel more inside of people's bodies, and my hands oftentimes would start to float off of people's bodies, and they could feel inside their bodies more when my hands weren't even touching them. So I was starting to pick up these subtleties that medical school never taught me. And then in 2020, I was forced to shut my practice down because for obvious reasons, and for a short period of time, but I started to work with a very high level intuitive. And she said, you are actually a very powerful energy healer, and you don't need to touch people to heal them. You know what to do. Just do it. So that was in May of 2020. And that was really where I made my transition. After 20 years of literally through my hands, putting my hands on patients and internally being able to see their anatomic world inside, I did my first treatment over Zoom, and the clarity was magnified. I actually saw more and could access healing in a different way, but a much more powerful way when working distance. So that's really where things started getting interesting, because I just started giving away all these remote treatments at a time when we had no access to care because we were all in this pandemic. So that was the beginning. And that was about 3 years ago now. And it has been a wild ride, a really incredibly expansive time for me of learning all about quantum healing. And what I'm now able to see, however, is how I can help people to learn their version of what I do so that they can actually work within their own bodies. And I teach this now.
So what do you call that? What is that?
Self-healing, energetic self-healing. It's a really tricky thing because by definition, I have to be really careful, because osteopathic medicine, by definition, by the American Osteopathic Association, is a hands-on modality, hands-on healing. So in order for me to put the words energetic and osteopathy in the same, lump them together, it's a pretty big, I have been told it's a misnomer. Now, it's interesting because there are quietly osteopaths all around the world who are doing exactly what I'm doing, not in my, we're all doing it in our own way. I think every single osteopath has unique gifts, and it's really the training that sets the osteopath apart from a cranial practitioner, for example. Because we've gone through medical school and we've had decades worth of training within the anatomic system, when we connect to patients, it's in that very specific medicinal way where, for example, I'll treat a rotator cuff. That's just, just as an example. If somebody comes and they start to ask me about their shoulder pain, after I synchronize with their energetic system, I'll be able to see the intricacies of their rotator cuff because I literally know it from the inside and outside. It's surgically precise. So that's really how this differs from like, for example, a Reiki. I get that question a lot. How does this differ from Reiki? When you're receiving a Reiki treatment from somebody who is trained in Reiki, unless they're a physician who understands the anatomic system, at that level, they're not going to be able to get into that nitty gritty, into the, the actual rotator cuff tear, for example, which I'll be able to see. So what we're really looking at right now is a paradigm shift. So, in the older paradigm, osteopathic treatment was a hands-on modality. In this new paradigm, it's quantum. We're all starting to wake up to the fact that we're made of pure energy and that we can actually, with our intention and with skills and gifts, work those energies into a place where the body then returns to a state of healing and wholeness. So I just happen to do it from my osteopathic background, my osteopathic training. And as a specialist within the musculoskeletal system, that's the level of expertise, I guess, that's
a wonderful progression. Like you said, bringing together, the best of all worlds, but you do have that grounded scientific training, which
it's
I think
in the body.
So different than someone who says they're a health coach and they're doing Reiki. I mean, we're not talking about that.
Exactly. And that's actually, thank you for saying that, Ellen, because, I think that is really, I see this a lot. I don't consider myself a spiritual teacher. I don't like labels, to be honest. I have training in osteopathic medicine. I do happen to be a licensed medical doctor, but I am really here to help you as the person, as the human that I'm working with, with this skill set that I've been able to I feel very gifted. I feel very blessed to have received it, to share it with you so that you get to know who you are, right? That's the most important thing about healing, is that it's about empowerment, and it's about this return. And I've always been an educator. I've always wanted people to know who they are and what they're made of, but inside their body. And that's been my lifelong fascination from the time that I started talking about, going to medical school, becoming a doctor. It was because I found the human body to be the most incredible, miraculous vehicle that our soul is housed in. And so really this mission that I'm on to help people rediscover this magic. It's more than that, right? It's like, first, I want you to know how incredible your human body is, how easy it is to actually heal it, how to get inside of it, how to turn on healing switches, and how to start moving it around to the place where it's restored to its wholeness again. That's what it's inclined toward. That's how our bodies are inclined toward the health. So our current modern medical system, as wonderful as it is, it's a disease. It's a sick care model, right? You get really sick, you have an emergency, your arm is falling off. You definitely want a surgeon to get in there and put it back together again. But what we don't do very well in our modern medical, system is really help people with this slow and progressive degenerative slide, downward spiral that the majority of people are finding themselves on, especially right now. So
share with me this. You have an organization called New Earth Health, right? Or New Earth Healthcare. What does that mean?
I don't actually have an organization called New Earth Healthcare. I do teach programs that I was calling New Earth Healthcare.
Okay.
But what I have in my website has actually changed. So it's to find me. My website is called Centers for Energetic Healing.com. So that's the organization, Centers for Energetic Healing. My partner, Claire, is an intuitive emotional healer. I'm an energetic physical body healer, and we've teamed up together with a third osteopath whose name, no relation, is Charles Bell. My last name is Bell. And the three of us we formed an LLC, a PLLC, that we call centers for energetic healing, which is it's both sides of healing. So it's the physical body and the emotional, but really packaging it in such a way that we deliver pragmatic tools, very easy to follow, lifelong tools for living. So new earth means new energies. There's new energies on the planet. Our bodies have changed so much. So before, we had a lot of stickier energies, a lot of denser energies. People are healing at faster rates. People are also dying at faster rates, as we're all witnessing. And the reason for that is because there's a massive evolutionary shift that we're all watching happen on this planet. And that same exact evolutionary shift is happening inside of our systems, inside of our physical form. So we're changing from one energetic system that has lower potency or a lowered ability to heal to a bigger energetic system, one that heals in bigger ways. But that also means that we're purging more. So we have more symptoms, a lot of us, that some people will call ascension symptoms, or, but what we're really seeing is that our bodies are ready to heal in ways that they weren't actually ready to heal. Even this shift has been going on now. I've been feeling it as I've been treating people really for the past 10 years, and then it accelerated back in 2020. So now we're in a huge shift, and we're starting to see the collapse of our current modern medical system because people are actually waking up to the fact that there's something missing, right? Love, energy, quantum healing, all of these terms are lending themselves to this awareness that there's more, right? Our modern medical system, as beautiful, as wonderful, as inventive as it has been, it's limited. It's not the whole pie. It's part of the pie. And we love that pie, right? Whatever it gives us, we are grateful because we all know people whose lives have been saved as a result of modern medicine. So I want to be, I always give my deepest respects to the doctors and the nurses who are out there right now on the front lines fighting that good fight, because we need them. We need you.
That's so true. Right. So I just want to remind our listeners that you're listening to Herbally Yours right here on the Voice of Nassau Community College, 90.3 WHPC. And our guest today is Dr. Jess Bell, giving us all kinds of wonderful tips and information. Thank you so much. Now, do you have something that we can share over the air of some action that an individual can take to just move themselves into a better place?
Absolutely. Yeah. So a lot of what I bring is this knowing that our bodies, our physical bodies, are made of the exact same elements that composes the elements of the earth. Okay. So we are we're just these little microcosms of earth. And in order for us, so using the power of our mind, our intention, we can reconnect to those energies. And I like to talk about it is, opening up the channel that reconnects us to the frequencies of the earth. Because when we use our conscious mind to consciously connect first to the body and then reconnect to the earth, we open ourselves up, our vessel up to come back into balance with her. Okay. So the earth has an energetic frequency of 0.1 hertz. And that's the energy of heart coherence, actually. Most humans walk around in a place that is not coherent. And when we're not coherent, we're burning tons of energy. We feel stressed. Our bodies feel stressed. When our bodies feel stressed, we don't have energy available for healing. We're only using energy. It's like we're stepping on the accelerator and the brake at the same time. And we're just revving all the time. We're burning out. Our adrenals get fatigued. Our thyroid gets fatigued. Our bodies get fatigued. We degenerate. So we have to flip that around. And this is how I often will tell people to do that. Remember where we came from. And this is not taught in medical school. This is not taught in our colleges. But when we go down into the body, when we get out of this crazy mind of ours, which is just constantly churning and thinking and burning energy, the very first thing that I have people do is just settle down, sit down, get down in the body, bring the energy down. And the best place to do that, to rest your attention, is in the very base of your pelvis. So that's where an energy center called the root center is located. And that root center, when it's open and flowing, and this is something that we can do in a matter of minutes, will start to exchange energies with the earth again. And so we've started to lose our connection to earth, living in modern homes, driving in our cars, wearing shoes with rubber soles and things like this. We don't connect to the earth the way that we did before. And so we don't just naturally get that absorptive resonance into our bodies. So we have to consciously create it and cultivate it, which is what we're designed to do, actually. So in the past, the indigenous people knew this. They lived outside, they slept outside, they walked on the earth with leather-soled shoes or no shoes at all, and they were constantly exchanging energy with earth. Now, here's a tool, okay? So may I bring us in? Because Ellen, I treat people this way, and I'll just say, I know we're coming to the end of the show, but I can do this in 2 minutes. So close your eyes if you can, if you're somewhere where you can, and go all the way down. Take your mind and bring your focused attention down to the very base of your pelvis. And at the base of your pelvis, there's a huge muscular sling called the pelvic diaphragm. Just focus on that for a minute. And then when you breathe, you're not breathing air, but energy. Imagine that you can direct breath right into the base of the pelvis. So when you breathe in, it opens up. And when you breathe out, it closes down, but also it drops down. And then you can start to focus on the energy of earth that's just under the body. And so that right there is a connection. The second that you make that connection to earth again, it will ground you down. It will calm you down. It will actually calm down your sympathetic nervous system and dial up your parasympathetic nervous system, which is the one responsible for healing. So there's a lot more that obviously we don't have time to go into it today, but that's just a very, very, very simple thing. If you find yourself feeling really erratic, really stressed out, direct the energy from your head, from your thoughts, and just go all the way down to the very base of the body and start to breathe down there, in and out, and then drop to the earth. Breathe these energies from the earth up into the pelvis. And a lot of times people can start to just feel themselves getting really relaxed and calm, even sleepy. And that's
so don't do it if you're listening to the radio.
If you're listening and driving, don't do it.
Which we have car listeners, Dr. Bell.
Yeah, so there's so much more to share. I've got tons and tons of content. I actually have a community called Self-Healing Immersion that you can find by going to my website, where I teach all kinds of good stuff.
And I'd like to invite our listeners to go to centersforenergetichealing.com to find out more. You had a fabulous story that you were sharing with us, and yourself have overcome tremendous challenges. I mean, talking about losing your father and being run over by a car at the same year when you were a child. I mean, you'd have to look at the astrology of that, like what planets were opposing each other. That's more than anyone should have to deal with. But instead of just pouting and running away, you turn that around into creating a wonderful life for yourself and being able to help so many others.
Yeah. Thanks, Ellen. I feel that we're all here being served, and the ways that we are served, the instructions that are all included in what I like to call a life map. We're all here to make changes and to evolve. And sometimes these big, huge traumatic experiences are the most important things for us to receive, to activate or to initiate us into action. And so that's just what that time of my life was. And I received a lot of guidance. I have and continue to receive a lot of guidance along the way. So I just follow instructions and, take it one step at a time.
Well, thank you so much for being our guest. And thank you for tuning in to Herbally Yours, produced in the studios of 90.3 WHPC, Nassau Community College, Garden City, New York. For further information, email us at whpc@ncc.edu. This is your host, Ellen Kamai, the natural nurse. You can find me at naturalnurse.com, inviting you to join us next week for another edition of Herbally Yours. Until then, stay healthy.